The point that I want to make today is that there needs to be a very strong voice in Canberra for healthcare on the coast, because while the Newman government has pulled out $3 billion from health in Queensland and cut 4,000 staff, the federal government has put in place an additional $1 billion over 4 years for hospitals. This cutting agenda from Mr Newman is only a taste of what's to come from Mr Abbott. So if Mr Abbott is elected Prime Minister, the cuts that we've seen on the coast and the threat to healthcare will be worse, because Mr Abbott has got a $70 billion hole in his budget bottom line, and he hasn't fessed up to the Australian people as to how he's going to fund that. And it can only be funded by big and savage cuts to healthcare, education, and of course that will hit jobs. So that's why there does need to be, here on the coast, a debate about the future of healthcare and which party can deliver the quality healthcare that's required for the residents of the coast over the years ahead.
This hospital here was proposed and agreed as a public tertiary teaching hospital. Nowhere in the world does any government operate it as a private subsidiary. Nowhere in the world, because it's too important. You've got to have links with the teaching component. You've got to have the specialties having the confidence they can provide the services that are needed in complex operations. Private hospitals cannot do that. Private hospitals can do all sorts of good things, but when cases get complicated, they have to be taken to the great public hospitals, particularly the teaching hospitals. The links with the Sunshine Coast University, the links with Sunshine Coast TAFE, have been irrevocably damaged by this decision. Confidence has been lost. Nurses in training are fearful of where they're going to get jobs. The medical staff are fearful of where they're going to get jobs. We're desperately searching for another university to take over the medical training for doctors. That has not been resolved. The research centre has been shelved. We're not sure where that's going to go. So you can see the picture here. This is a step into the unknown, and I can tell you the people of the Sunshine Coast are not enjoying the fact that they're being used as lab rats in this grand Americanisation of the public health system.
You can't be assured that the new hospital will be adequately staffed, and if services are privatised and profit becomes the primary motive for the operation of the hospital, then I would suggest that services will be under further pressure. Our public hospital system has been put there for the good of all. It is not operated on the basis of a profit model. What the Newman government is saying is it must be profitable, and when they say that, what will happen is that staff numbers and quality of care will be affected, and that has been the experience elsewhere.
What we have here is a classic case of safe seat syndrome. The hardest thing our representatives have to do now is win pre-selection. Now, I've seen that happen before, you've seen it happen before, but I've never ever seen elected representatives act against the interests of their own constituency, and that is what is happening here. Shame on them for doing that. That is not what they're there for. They're supposed to stand up and have a voice. That's what I guarantee to do.
Well, the Queensland government hasn't addressed its budget deficit at all, or its debt levels. In fact, what it did was slash and burn through the health system and education system to fund new promises, and after that it's still got about the same level of debt and deficit that the previous government had. So one of the great fallacies out there is all these cuts have been used to bring down deficit and debt. It's simply not true. The fact is that those cuts have hit the level of services and so on. There is no crisis in the Queensland budget. What you've got is fiscal fear-mongering from both Campbell Newman and the federal coalition to justify huge cuts to the social safety net, because they actually don't believe in free public hospitals and actually want a for-profit model put in place to replace Medicare. I'm not aware of any other major public hospital around the country where they have put in place the sort of proposals for outsourcing and privatisation that are being proposed for this public hospital. What this public hospital is going to be is a laboratory, if you like, for an LNP experiment to change the very nature of public hospitals in the state. And I happen to think that locals here will be pretty concerned about that.
As a seasoned campaigner, what do you think are the big issues for the Sunshine Coast that could win or lose these seats?
Well, apart from the issue of health, which is obviously really important, I think the big issue nationally is jobs and growth. Which party has got the policies in place to support employment and to make sure that families have access to affordable health and education? Really, that's the Australian way. And of course, I believe that because Mr Abbott has got a $70 billion hole in his budget bottom line, slashing the budget to make up for that, which is what he would have to do, would mean the imposition of European-style austerity policies on Australia, and that would see a loss of jobs and a loss of economic growth. So I think when it comes to the classic economic question, the Labor Party is the party for growth and jobs and prosperity, and the Liberal Party is a party that wants to take a pretty big axe to the social safety net through very big cuts in health and education, which will hit economic growth, hit jobs, and hit the quality of care in the health system.